If you're over 65, you've probably been told that walking is the best exercise you can do. And it's true. Walking keeps your heart active and your body moving. But here's what most people don't know. After a certain age, walking alone isn't enough. In fact, orthopedic surgeons now agree that there are 3 simple exercises that do more to keep you independent, strong, and pain-free, especially for your joints, balance, and energy levels. Think about it. Have you ever finished a walk and still felt stiffness in your knees or lower back? That's because walking mostly trains your endurance, not your stability or your deep postural muscles. As we age, those smaller muscles, the ones that protect your joints and keep you balanced, start to weaken. And when that happens, even a daily walk can start to cause pain instead of preventing it. I'm Dr. John, an orthopedic surgeon who has worked with older adults for more than 25 years. In this video, I'll show you 3 doctor-approved exercises that are better than walking. Not because walking is bad, but because these moves train the parts of your body that walking misses. Each of them takes less than 3 minutes, and together they'll help you regain balance, protect your knees, and even improve circulation. When we walk, we rely mostly on repetitive forward movement. But real strength and stability come from multi-directional motion, side to side, twisting, and controlled holds. That's exactly what these 3 exercises do. They activate your deep muscles, increase blood flow, and protect your joints from the inside out. Let's start with the first one, a simple exercise that improves circulation, strengthens your calves, and reduces swelling in the lower legs. Surgeons often call this movement the secret to preventing what we call venous stagnation, the buildup of blood in the legs that leads to fatigue and pain. Have you ever noticed how your legs can feel heavy or swollen after sitting for a long time? That's because blood tends to pool in the lower legs as we age, especially when the calf muscles, which act like a second heart, aren't pumping as strongly as before. The first exercise targets exactly that. It's called the heel lift pulse, and it's one of the simplest yet most powerful ways to improve circulation and strengthen the muscles that support your knees and ankles. Here's how it works. Stand tall, feet shoulder-width apart, and gently lift your heels off the floor until you're on your toes. Hold for 1 second, then lower your heels slowly until they almost touch the ground, and then lift again. This slow pulsing motion creates a natural pump in your lower legs, pushing blood upward and reducing swelling and stiffness. You don't need to rush. Try doing 15 to 20 gentle pulses, rest for a moment, and repeat for another round. If balance is a concern, place your hands on the back of a chair or against a wall. You'll still get the full benefit, and over time, your calves and ankles will feel stronger and more stable. What makes this exercise so effective is its hidden impact. When your calf muscles contract, they help your veins move blood back toward the heart. This improves oxygen delivery throughout your body, meaning your muscles and even your brain get more energy. Many surgeons recommend this kind of movement for patients recovering from leg or hip surgery because it promotes blood flow without joint stress. That's why it's often called better than walking for circulation. You might be surprised how much of a difference this small action can make. Do it while brushing your teeth, watching TV, or waiting for the kettle to boil. The key is consistency. A few minutes every day keeps your legs active, flexible, and refreshed. And here's something even more interesting. After 2 to 3 weeks of daily practice, most people notice they can stand longer, walk farther, and experience less stiffness in their knees and ankles. It's a small habit with big results, especially for anyone who wants to stay independent and pain-free.
Now that we've boosted circulation and strengthened the lower legs, it's time to move upward to the muscles that protect your hips and spine. The second exercise trains your balance, posture, and stability, things walking alone simply can't do. One of the first things that changes as we age is balance. It doesn't happen overnight. It starts slowly, when simple movements like bending down or turning too quickly begin to feel less steady than they used to. That unsteadiness isn't just a coordination issue. It's a sign that your hip stabilizers and core muscles are weakening. These are the very muscles that protect your spine, help you stay upright, and prevent falls. The second exercise strengthens them in a safe and controlled way. It's called the standing balance reach, and it's one of the best full-body movements for stability after 65. Unlike walking, which moves your body in a straight line, this one challenges your muscles to balance and adjust, the kind of strength you use in everyday life. Here's how to do it. Stand tall with your feet hip-width apart. Shift your weight slightly onto your left leg. Now, with your right hand, reach forward as if you're trying to pick something up from a table just beyond your fingertips. Keep your back straight and your core gently engaged. Then return to the starting position slowly and repeat 5 to 10 times before switching sides. It may look simple, but you'll feel your hips, thighs, and abdomen working together to keep you balanced. If you need support at first, lightly touch the back of a chair with one hand. Over time, as your balance improves, try doing it hands-free, even closing your eyes for a few seconds to make it more challenging. Why is this exercise so important? Because every time you shift your weight and stabilize yourself, you're training your body's built-in balance system, what doctors call proprioception. It's your brain's way of knowing exactly where your body is in space. When you practice this daily, you're teaching your muscles and your nervous system to react faster, keeping you steady and reducing the risk of falls. Many surgeons and physical therapists recommend movements like this after hip or knee replacements. It retrains coordination, strengthens the deep muscles that protect the joints, and restores confidence in everyday movement. You might even notice that walking feels smoother and lighter after doing this exercise for a few weeks, because your body has learned how to move with better control. The beauty of the standing balance reach is that you can do it anywhere, beside your bed, in the kitchen, or even while watching TV. Just a few minutes a day is enough to remind your body how to stay grounded, steady, and strong. Now that your lower body and balance are working together, let's finish with one final exercise, a movement that improves posture, strengthens your back, and keeps your whole body aligned as you age. Good posture isn't just about looking confident, it's about keeping your spine, shoulders, and breathing muscles in harmony.
Over time, many people start to hunch forward, especially after years of desk work or phone use. That rounded posture makes the chest tight, the back weak, and the lungs less efficient. The good news is that you can reverse much of that stiffness with one simple movement: the wall press extension. Here's how to do it. Stand facing a wall about 1 arm's length away. Place your palms flat on the wall at shoulder height. Now slowly bend your elbows and bring your chest toward the wall, as if doing a gentle push-up. Then press back until your arms are straight again. As you extend, open your chest and squeeze your shoulder blades together. You'll feel the back of your shoulders and upper spine come alive. Do this 10 to 15 times, breathing naturally and keeping your stomach gently drawn in. The motion shouldn't feel heavy or forced. It's a controlled glide that activates your upper back while improving shoulder flexibility. If it feels too easy, take a small step back to increase resistance. If it's challenging, step a little closer to the wall. This movement strengthens the muscles that hold your spine tall and keeps your posture upright even when you're tired. Why do surgeons recommend this one? Because posture and breathing are deeply connected. When your chest opens and your back supports you, your lungs expand more fully, your oxygen levels improve, and your energy rises. Many older adults notice that after just a week or two of daily wall presses, they breathe easier and walk taller without thinking about it. It's one of those rare exercises that benefit your body and your confidence at the same time. Now take a deep breath. You've just completed 3 simple, surgeon-approved exercises that together work better than walking alone. The heel lift pulse improved your circulation and reduced swelling. The standing balance reach strengthened your hips and core for better stability. And the wall press extension opened your chest and aligned your posture for easier breathing and a stronger spine. Remember, you don't need fancy equipment or long workouts to stay active after 65. What matters most is consistency. A few minutes a day, done mindfully, will do far more for your strength and independence than pushing yourself through long, exhausting walks. If you found these exercises helpful, make them a daily ritual. Your body will respond faster than you think. In a month, you may notice that climbing stairs feels easier, your back feels lighter, and your confidence grows with every step. That's the power of training smarter, not harder. Take care of your body. Listen to it. And keep moving, because movement is life, and you deserve to keep living it fully at every age.